Ways to improve patient satisfaction. Patient satisfaction, while always a critical factor, has recently gained momentum in the healthcare space. In the wake of the patient-centered healthcare environment, patients are demanding a bigger role in managing their healthcare, and they expect a higher level of commitment and care from their providers. Healthcare providers are adjusting their strategic plans accordingly. Healthcare organizations have realized that the only way to sustain their practice is to focus on patient experience and provide high-quality service and care. The patient satisfaction journey starts from the first time a patient contacts your practice and continues until their bill is paid. Why is patient satisfaction important? Patient satisfaction is the most important and commonly used factor for measuring the quality of healthcare. Patient satisfaction affects clinical outcomes, patient retention, and medical malpractice claims. Simply put, patient satisfaction is an indicator of how well the patient is being treated at your medical practice. The how well refers not only to the quality of care, but also to how happy a patient is with the treatment received. It is a measure of the quality of care and gives healthcare providers valuable insights into various aspects of healthcare, including the effectiveness of their care and their level of understanding. Here are some ways to improve patient satisfaction. Go digital. In the era of the internet, there is no reason to not connect and engage with your patients. Around 40% of doctors agreed that using digital channels to connect and communicate with patients will boost patients' outcomes. Decrease wait time. There is nothing more frustrating than showing up on time for an appointment, only to wait in the waiting room for about 30 minutes before your turn comes. Most patients would switch to doctors for a short waiting time. Keep your staff happy. Creating a happy and uplifting work environment for your staff can make for a better overall patient experience. There is a strong relationship between staff satisfaction and patients' perception of the quality of their care. Educate your patients. Providing your patients with the necessary information is critical to achieving a positive patient experience. A patient will feel empowered when they leave your office with more knowledge about their diagnosis and treatment options. Not just that, studies have revealed that greater patient empowerment leads to better patient adherence, which leads to improvements in patient satisfaction and clinical outcomes. Train your staff. Make sure your staff is focused on delivering service that is not only high quality, but also delivers a positive patient experience. The first step to ensuring patient-centric care is by making sure that your staff has this common goal in mind. You should encourage your team to suggest ideas for improving patient satisfaction within your practice. You should convey the message to your staff that providing exceptional patient service is not an option. Rather, it is compulsory for every employee. Your staff must realize the significance of providing excellent service to patients and their families. It is critical to hold your staff responsible for the overall patient experience. Build a follow-up mechanism. Patients usually get irritated by their inability to communicate with their providers between appointments. You can use technology and build systems that open the lines of communication between the doctor and the patient. This will not only foster long-term patient relationships, but will create better clinical outcomes by making it easy for patients to schedule appointments. Make it personal. Healthcare professionals who make an effort to maintain eye contact with their patients, rather than distractedly looking at computer screens and charts, demonstrate their dedication to the patient. Some practitioners may choose to have a medical scribe in the room for this very reason, allowing them to listen with their eyes while the scribe takes notes. Saying a patient's name also helps individualize and personalize the patient experience, as does asking questions like, "What matters to you?" Upgrade your old system. When we are talking about patient satisfaction and patient experience, upgrading outdated internal systems is the key. Even small changes to appointment scheduling platforms, waiting room signage and systems, and nurse call buttons can have a significant impact on patient satisfaction. Keep your practice neat and clean. No patient wants to receive care in an environment that doesn't feel safe and clean. Practicing cleanliness in all areas of the institution, from the waiting room to the physician's office, helps protect patients and puts them at ease. Patients want to be comfortable during their hospital visits and want their needs to be understood. Improving patient satisfaction means understanding the facility's unique patient population and its needs. What will please one group of patients may not satisfy another, and hospital leaders must bear that in mind. Changing little things like a smile, keeping patients updated about wait times and appointments can do wonders for you. The above tips can help you to improve patients' care and satisfaction without much investment. Thank you for watching.